Hello, this is Dr. Rochelle. I hope you are enjoying this beautiful weather, the beautiful summer. But I did want to take a few minutes and talk to you about none other than the gut, one of my favorite subjects. As you probably know by now, the gut is extremely important for our health. So I'm going to take a few minutes, just talk to you about the gut. How does it go off track? How do you know your gut is off track? And then more specifically, what are some tests you can do to find out what the problem is and what I think is the best way to find out what the problem is in my experience. And then quickly about how to repair it. So, the gut is extremely important for our health. It houses your beneficial bacteria. There are billions of good bacteria. They make up more than 70% of your immune system. And basically these bacteria dictate the health, your overall health. When the bacteria go off track, that will negatively impact your health. By off track, I mean when they are out of balance. How do they become unbalanced? How does your gut bacteria go off track? Well, we can start way back in that when we are born, if you're born by C-section, for example, versus by vaginal delivery, that can be one way that you may be inoculated with less bacteria because it's a sterile environment in C-section versus someone who's born by vaginal delivery. And then, toxins you're exposed to at birth, that can have a beginning impact. But as you go on, some of the major ways that the gut can go off track are things like medications and antibiotic intake. That can basically kill off your good bacteria. Things like oral contraceptives, birth control pills, synthetic hormones, steroids, and medications such as anti-inflammatory agents like Advil. That's one way. Another way would be poor food, poor diet, high sugar intake, processed foods. Another way would be exposure to toxins in your environment and toxins in water. And stress itself can take your gut bacteria off track. So these are some of the ways. And then how do you know that this has happened? How do you know that, there's imbalance in your gut bacteria? One of the easiest ways to tell is if you have gastrointestinal symptoms such as bloating, burping, gas, reflux, abdominal distension, changes in your stool, such as, being constipated or having loose stool. But there's another way you can tell. If you can tell that this may be actually a root cause, is if you have another chronic issue. For example, if you suffer from eczema or acne or hives or frequent allergic reactions, autoimmune disease, even such things as fibromyalgia, chronic fatigue, brain fog, ADD, difficulty concentrating, really any ill symptom can have its root in your gut. So it's always good to have that on your radar and on your doctor's radar. Conventionally, they don't look at the gut the way we do in functional medicine. It is all in the literature. However, it's not in the mainstream medicine yet, but it will be. That's why functional medicine is called 21st century medicine. So if you feel that this may be a problem if you do have GI symptoms or you suffer from one of these conditions, even hormone imbalance or hypothyroidism, really anything is fair game. Any problem can have its root in the gut. So what are the best ways? How do we find out what's going on, right? Traditionally, they just do a colonoscopy, which looks for gross abnormalities, such as, God forbid, tumors or bleeding in the colon, things like that. In functional medicine, we look more closely we want to name the kind of, good bacteria you have, bad bacteria, fungus, parasites. We want to look at your digestive markers. So we're more specific about what's going on. So what are, two main ways we do this is one by urine testing. Urine testing looks for metabolites, little, compounds that are made by the bacteria or fungus. Another way is when we culture the stool and see what grows out in the lab over a few days period and actually name the bugs. From these two modalities, sometimes the urine is more convenient. Some labs seem to be less expensive that offer these urine tests. They can go along with blood tests and combination tests, but and they may have partial insurance coverage. However, clinically, they are valuable. They do give us information. But in my practice, I have seen many patients who've had these tests done who are just still suffering from the problem. So that's always interesting. So they've had the test done, but the problem is exactly where it was. So that's an odd thing I find. That's why in my practice, I like to use a complete stool analysis parasitology ×3, which is a stool culture. This test is slightly more expensive and usually not covered by insurance. However, you get, in my practice, we've always gotten clear answers as to what's going on. The test is smart in the way that it can name the bad bacteria by name and, grow them out, look under the microscope, see what do we see there, look at growth of Candida, name the Candida. And by name, I mean when you name it, you're able to exactly give a sensitivity, which tells us what natural agents, botanicals, or even antifungals or even antibacterials work against this bug. So we actually have a clear answer as to what's going on. The tests also tell us about your digestion, your digestive markers, whether there is inflammation, about the short chain fatty acids, which are very important compounds made by your colon cells. So that's why I really like to use a stool culture to find out what's going on. I also sometimes use the urine test, but I find the stool culture extremely valuable. So when we get these answers, what do? We will get in there and basically correct the problem by using the 4R program or some form of it, which is generally removing the bad, replacing the good, re-inoculating your gut with the good bacteria, and repairing your lining. This is sometimes, it's not going to be as easy as, in conventional medicine, here, just take this pill for 3 days. It is a little bit of work in that we have to do this process. So you have to stick with it. It takes a few months, but most of the time, always, if you stick with that program, the symptoms always go away. We can repeat the test and make sure they've gone away, but your clinical symptoms tell you if all your GI symptoms are gone. So many times we see complete resolution of eczema, immune markers normalize, ANA goes negative, clarity in the mind, energy levels up, hormones balanced when you fix the gut. So I just wanted to take a few minutes of your time on this beautiful day to talk about your health and the very important gut. And I hope you have a great rest of your day. Talk to you soon.